are you snapping?
Okay. First of all, it's what us Juilliard-trained broadcasters do to sync sound.
Okay.
Why do you stick a thermometer up the backside? I mean, what's that all about?
Checking temperature.
Okay, well, you have your way to do things. I have my way to do my things. And welcome to another edition of the KellumMD.com video podcast. Gabe Farias, Dr. Daniel H. Kellum Jr. We are here talking each and every week about a myriad, a plethora, just a jumbulation. A jumbulation.
Plethora. If you're going to keep saying it, it's plethora.
It doesn't matter how you pronounce plethora.
I mean, if you want to sound like you know what you're talking about.
You know what's funny? I'm friends with Tony Plana. Not to name drop, Tony Plana from the Three Amigos. Okay, he played Jefe. Why, El Guapo? He goes, I would just like to know if you use the word plethora, what it means to have a plethora. He was the guy with the sombrero on the, anyways.
And the accent.
And the same, Tony Plana couldn't be a nicer guy.
I don't know him, I'm assuming.
And he told me, Mr. Farias, it's plethora. Right. Thank you. Okay, so from the expert himself from the Three Amigos. Anyways, Dr. Kellum, I don't know how we get off topic.
I don't know either.
I know how. It's because I'm an idiot. How are you doing, my friend?
I'm doing good, my friend.
Can you diagnose my idiocy?
No.
Really?
There's just no help for that.
Wow, that hurts my heart just a little bit. Dr. Kellum, it's No Shave November. By the way, KellumMD.com is the sponsor for this podcast. If you visit KellumMD.com, you can learn about all of the clinics here in Schertz, Texas, in Bergheim, and the new one that's coming up out in Westover Hills. Dr. John Kellum has an OBGYN clinic over off of Marbach Road where your father has a family medicine clinic out there. So anywhere in the greater San Antonio area, we got you covered. Just visit KellumMD.com. Dr. Kellum, it's No Shave November, an ode, really people being mindful of all the cancers that are out there in this world. And you guys have got some really cool, innovative ways. You can call them executive physicals. It's health grades. Right. It's a way to get checked. It's a full head-to-toe check. How important is it to get blood work and to get checked regularly so that you can avoid some of these ailments that can get you?
Well, I mean, very important, obviously, I think is the standard answer to that question. But I think that certainly the depth in which you look at in terms of the screening is very important. Certainly there's age marks that we use to look at certain things, colon cancer, getting colonoscopy or a Cologuard equivalent at age 45, breast cancer screening at age 40, prostate cancer screening at age 50. I mean, we have those individual marks that we look at, but also too, in terms of, getting a physical done. When you do that, you can look at blood work that looks at things like lymphoma and leukemia. You can do sonograms that look at thyroid to look at thyroid cancer, or looks at the kidneys to look for kidney cancer. Because some of these things are difficult to really evaluate if you're not actually looking at them anatomically. And so there's a variety of ways that I think you can look at. But I think the most important take for most individuals is to be mindful of the milestones in terms of preventative care and screenings that need to be done. We just came off of Breast Cancer Awareness Month. I think that's super important. So again, it doesn't have to be October to get your mammogram done. Please get that taken care of because that is very, very important, curable, and certainly can affect you and your family in negative ways if not addressed.
Is it once a year? I mean, what's a good benchmark to get checked?
So you know what? That's different ages and different conditions. But I would tell you yearly to get looked at, and maybe not yearly as in depth all the time. And I think that's certainly between the physician and you to really understand your individual situations. But getting yearly, at least yearly, in front of the doctor to talk to him about how things are going, to maybe have him have or her have some insights into how you're doing as well. And then that certainly can be tailored to the individuals. But there's certainly hard stops that we use or hard times that we use to check certain things. But I think, at least once a year, get in front of the eye doctor, go to the dentist, go see your primary care doctor, because all of those things play into your overall health, whether it's gum disease, whether it's eye disease, whether it's any kind of metabolic disease, cholesterol, diabetes, thyroid. Those are the things that we can pick up on checks. Blood pressure is a great example because you never really feel it. And if you don't feel it and it takes its toll on you, you don't want strokes or heart attacks to be the first sign of anything, something as simple as that.
Take me through the physical that you offer, the health grades physical, because I've had it done several times, and people ask me about it, and I'm like, it's game changing. You found a nodule in my thyroid that really helped with what could have potentially been, it's needle in a haystack when you're doing a regular physical, but for a physical like that, you can catch those types of things.
We do. And so the test we do here is a very complete test. And so it starts out at looking at your blood work so that we can look at all the things I talked about just a second ago. Second thing it looks at is sonogram screening. So we look at the aorta, we look at the carotid arteries, we look at the thyroid, we look at the blood flow into your lower extremities, we look for aneurysms, we look at your kidneys, we look at all of those things via sonogram, because sometimes it is hard to touch and feel those things unless they're big enough that they're problematic. Thyroid is a great example. Like you, Gabe, you see a mass. That mass is a certain size. It prompts you to go do a biopsy. And I can't tell you how many thyroid cancers we've picked up and have been able to eradicate because we've instituted these much more in-depth looks at individuals. What we learn in school in terms of how we do a physical exam manually with our hands is very good, and I don't ever want to downplay that at all. And if that's what your doctor is doing, I'm sure he's doing a fantastic job. But there are other ways, I think, that can be a little more thorough that really do open up the door. So that when you're looking at things like, for example, cholesterol, and you see a certain level if it's elevated, and then you see if there's any plaque that's being laid down in the arteries, then you make really good decisions because you can mirror them up. If and so those are the kind of things that our physical does. It looks at lung function, looks at nerve function, it looks at brainwave function, and it really gives us and we do a chest x-ray and EKG, and so it gives us a very complete look at where one's baseline is.
And it just goes along with the theme of this holistic realm of care that you offer. I know in last week's podcast we talked about the pride that you take in improving the quality of life. Right. You're not just giving these physicals for the sake of something checking off of a list. No. You're doing it because the whole premise is to improve the quality of life of the healthcare for your patients.
Very, very true. First and foremost, it's what people deserve. I think. I mean, people deserve the best care that's out there for an individual. And so we do that, and we always are working to find the latest things that we can do that really do set us apart and make a difference for the individual. Secondly, quality of life is really important, but the ultimate thing for me, and I think where medicine is evolving, is longevity. And so not only do we want people to live well, we want them to live a long time being well. And so the things that we're employing now with these physicals and with the things that we're doing, hormone therapy, a number of other things that we do as well, nutritional consultation, we really are trying to create an environment where disease is limited, quality is improved, and longevity is achieved. And when we're able to hit that trifecta, I think we're really doing a great job. Ideally for a doctor like me, the best thing we could ever do is not treat disease, but just prevent it from happening. And if we could ever get to that point in a theoretical place, it would be fantastic. Unfortunately, it's not, for a variety of reasons: foods, lifestyles, a number of other things. But there are mechanisms and means to really try to at least move in that direction. And so getting in front of your doctor every year is really the start for all of that to occur. And in doing that, going back to No Shave November, it really allows us opportunities to catch things early, if God forbid they're there, and make a significant difference with that.
Every time I bring up this analogy, I feel a little stupider, but I can't. I guess I'm such a simple guy that I can't think of any other analogy to come up with. But it's like taking care of your car. You got to get maintenance on your car. If you get maintenance on your car, you don't have to take it in to get the transmission fixed. You don't have to take it in to get the brakes, or if you do maintenance, and it's kind of the same theory that you theoretically take with medicine, and how you got to get checked up.
And it's, gosh, Gabe, it's a great analogy, but it's a mind shift, a thought process shift. From generations to generations. Generations before us went to the doctor when they were sick. And quite frankly, doctors only wanted to see you when they were sick. We didn't have the tools, we didn't have the understanding, and we didn't have the foresight to really deal with prevention. Younger people that are coming up, they are very aware of their bodies, they're very aware of how they feel, and really they're very good at understanding the preventative things that are necessary. And so as we continue to create this mind shift among the population, at least the communities we serve, we really try to push that, because that really is where medicine is going. And so I'm with you, Gabe. If we can, much like your car, if you catch it before it makes a noise, then you're doing a much better job. And that noise could be a heart attack, it could be trouble breathing, or it could be your motor running out.
It's the reason I continue to drive a 93 Ford Escort, my friend. I've taken care of that thing.
It's a bad boy.
642,000 miles, my friend.
And you still don't fit in it.
And speaking of the evolution of medicine, we've got some great universities here. University of Incarnate Word. You got 2 new doctors of osteopathic medicine that have joined the team. Talk about the 2 new ones.
So 2 wonderful young ladies,
Yeah.
Dr. Allison Ogle and Dr. Lauren Hatherall, joined us.
By the way, I got to tell you, we did some stuff with them earlier. They couldn't be 2 of the nicer individuals that I have ever had the pleasure of dealing with. She worked with I know that the person that handles our social media. She came in smiling. She's like, they were so nice, and they are, and they're great providers also.
They are. So I had the opportunity to teach them as medical students. Lauren, not Allison, because as you know, I do some clinical teaching.
You're a professor as well, an adjunct professor.
They spend time with me, and so I got a chance to know her, and we were blessed enough that she wanted to join us. And then Dr. Ogle came. She's in our Berkheim location, close to her home. They're wonderful providers. They're wonderful mothers. They're wonderful wives, and we're just glad to have them as part of our family. And the nice thing about them, for a lot of y'all that are coming in, is they're very relatable to the everyday issues that that younger people are going through, younger families are going through. And so, I strongly encourage people, if they have an issue, to come on in and see them. I think you will love them. They're very good at what they do, and I think you will find them very easy to talk to.
All right, Dr. Kellum, thank you so much. 2 questions. What's going on with our Cowboys, man? Like, I am nothing like ending a podcast on a downer, right?
Yeah. So let's not.
They're going to turn it around, folks. They just signed a receiver that's averaging a half a reception a year. I'm telling you, Zach, it's going to happen, right?
Yeah.
Mr. New York Giants over there. And the Spurs, man, they're feeling themselves.
But they were 0-13 last year.
They were, and they're getting better.
They're 3-4 this year.
We've been to a few games. I'm excited.
Yeah.
Chris Paul, he doesn't look like he's 64.
Right.
He plays like he's
I'm excited
younger.
about that, and hopefully, and we pray for Coach Pop.
Yeah.
We know that he's sick. I don't know what the deal is, but just reading about it, I hope and pray the best for him.
That's it. All right, folks, remember, if you want to check out, set up an appointment here, 210-945-2121, or visit KellumMD.com. Set up an appointment with Dr. Kellum, any of the fine providers, Dr. Hatherall, Dr. Ogle, or a list of wonderful providers that we have here at Kellum in Schertz, in Berkheim, and right there off of Marbach Road in the west side of San Antonio. Soon to be a 4th location off of Braun and 1604.
Right.
You guys are growing.
Yeah, we're excited about that.
All right, folks, for Dr. Daniel H. Kellum Jr., I'm Gabe Farias. Stay healthy, folks.